So thanks so much. Today we're here again talking about what has been a historic victory for people. The fact that we've been able to use our power to secure dental care for people, to bring help to people in this difficult time is incredible. Before I get into that part of our announcement, I just want to reflect on the war in Ukraine. President Zelensky, who spoke in Parliament, has asked us to reflect on the fact that it's been 1 month since the war began. In his speech, he asked Canadians, he asked parliamentarians to imagine what it would be like to have our homes and our communities and the cities that we know across the country being attacked, tanks rolling in, being bombed. He asked us to imagine what it would be like to see schools and children's hospitals bombed and attacked. And he asked us to imagine what it feels like to try to explain to a kid what's going on, to try to explain to children why we're being attacked. And he asked us to imagine all of that, and then he asked for more help. So I want to reflect on the fact that it's been a month now since Putin's flagrant violation, illegal war, human rights violations that are going on. And I want us, again, to amplify the call for more help. I know that Ukrainians are coming to Canada, but they're not getting supports. The Ukrainian-Canadian Congress has mentioned that people are coming here, but they don't have enough support to get connected with housing, to get connected with a job. And so this is a serious concern, and we're going to continue to push for that. More help for Ukraine and more help for people that are fleeing this humanitarian crisis. And today I do want to talk about the impact of what we've done. We've used our power to get help to people now. And in a world where people are feeling less and less safe because of a war, a pandemic that's lasted over 2 years, and then we've got the cost of living going up. This is real help that people have told me they need, and we've been able to deliver real help to people. And we're really honored and excited about what that will mean for people. The fact that we can get dental care started this year, to get people the help they need, to start with children under 12 who are the most vulnerable and who don't have coverage will get coverage, to make sure we expand that to children under 18 and to seniors and people living with disabilities in the second phase. And then in the third phase, to expand to everyone who needs coverage, who doesn't have it, the people who need it most who don't have it, and to make sure that they can get their teeth fixed. That is meaningful and that is concrete. And we've been asked the question, we often get the question, how are we going to pay for it? In the deal itself, we lay out one specific path to pay for it. That's to tax the excess profits of financial institutions and insurance companies that have been posting record profits in a time when people are struggling. And simply by making the government do what they promised to do, tax the excess profits with a surtax of 3%, we can pay for this program. And we're also talking about a plan that's going to save money for people. And we have Dr. Kaplan-Murth here who's going to talk about what this means for young people and how this is preventative care and how this is going to support people being healthier longer, which is going to save money in the long term, but most importantly, going to keep people healthier in the long term. And finally, this is a plan that's going to be phased in as I've described. It's going to be phased in so that it's a practical and it is a responsible way to make sure people get help in a real way in their lives. And we're really excited by it. Not to mention the rest of the deal, which talks about how we can continue to get help, real help to people when it comes to finding a home they can afford, when it comes to fighting the climate crisis, and delivering on the supports that people need in their lives. We're honored to be able to do this. This is a big win for people, and we're honored that we were able to use our power to deliver this big win. Donc aujourd'hui, je veux commencer en reconnaissant les mots de président Zelensky. Il a demandé qu'on réfléchisse sur le fait que c'était 1 mois que la guerre a commencé, que l'agression flagrante du président Poutine a commencé. Et il a aussi demandé qu'on continue d'aider les Ukrainiens et on va continuer de les aider. Aujourd'hui, je suis ici avec des militants qui appuient le fait qu'on a utilisé notre pouvoir pour des gains pour les gens. On a utilisé notre pouvoir pour livrer l'aide aux gens. Et c'est vraiment important. Aujourd'hui, vous allez entendre médecin, docteur Kaplan-Murth qui va expliquer comment ça va aider les enfants qu'elle voit dans son bureau. Et on veut aussi partager comment notre plan est un plan prudent, pratique. On va commencer avec les enfants moins de 12 ans qui en ont besoin de cette aide le plus, et puis continuer avec les enfants moins de 18 ans et les aînés et les personnes vulnérables, comme les personnes handicapées, et puis toute la population qui n'ont pas de couverture, qui ont besoin d'aide le plus. Donc, on a un plan. Et comment on va le payer? On a un plan aussi. On va taxer les profits excessifs des grandes institutions comme des banques et les entreprises d'assurance. On a un plan. Et c'est quelque chose qui va vraiment aider les gens de rester en santé et aider les gens dans leur vie. Donc, on est tellement fiers de ce plan. On est fiers qu'on ait utilisé notre pouvoir pour une grande victoire pour les gens, la plus grande expansion de notre système de santé dans une génération, et on est très fiers de ça. So with that, we're really excited about this first step towards the biggest expansion in our healthcare system in a generation. And we're looking, and I'm going to invite Dr. Kaplan-Murth to share what this would mean as a family physician here in Ottawa, what it would mean to her patients, and what it would mean for families. Thank you so much, Doctor. The mic is yours.
Thank you, Jagmeet. It's an honor to be here, and it's also an honor to be here with Ed Broadbent. So my name is Dr. Kaplan-Murth. I am a family doctor in Ottawa. I'm also associated with Canadian Doctors for Medicare, who have worked very long and hard toward the goal of increasing access to care for all Canadians. So, our system is broken. We fund some body parts, but do not take care of others. A year ago, I brought together a roundtable to speak with Prime Minister Trudeau about equitable access to COVID vaccine for Canadians. We need equitable access to all medicines and all facets of healthcare across the country, across political and geographic borders. And this agreement, the Supply and Confidence Agreement, is a good step forward. This is about people. So let me tell you, as a family doctor, I know which patients of mine will struggle to fill a prescription. It is heartbreaking to sit with patients who are single parents or seniors or people with disabilities who don't qualify for provincial disability coverage but can't afford to see a dentist or don't have private insurance or the family or others that they can turn to for help. They're struggling just to buy groceries or pay their rent. They're shy and they're ashamed to tell their doctors that they can't afford to fill a prescription or to get the care that they need. It doesn't make sense that we don't take care of people's teeth, for example, yet we end up seeing those same patients in emergency rooms because of heart infections that were caused by poor dental care. So as a family doctor, I implore Canadians to stop working in silos. We have to start to treat the whole person. We have to truly provide care to every person. We have to, as Jagmeet said, use our power to help everyone. Yes, a pharmacare program and a dental coverage program are both crucial. We need to do so much more, though. We need to invest in mental health care. My patients can't access mental health care unless they have deep pockets. We need to invest in primary care. Everyone should have a family doctor like me who is out there on the streets advocating for them all the time. We need help for people to navigate our healthcare system. We need to address the long-term care crisis. We need to address the housing crisis. In Ontario, we still need affordable childcare. All of these things are very fundamental to basic health and well-being. So I thank all the leaders and all the team of people who have been behind working towards putting this Supply and Confidence Agreement together, and who will continue to work towards the agenda of helping my patients and all Canadians. Thank you.
Thank you. Thank you so much, Dr. Kaplan-Murth, and thanks for explaining how this would concretely help and all the other help we need to do. And I think it's an important reminder that this agreement is a big step forward for pharmacare, for dental care, But the work doesn't end. We're going to keep on fighting to make sure we invest in our healthcare broadly and we invest in people in general. I also have to say I'm so honored that Ed Broadbent, our former leader of the party, is here, a friend and mentor. And with that, we're ready to hear any questions you might have.
Thank you, Jagmeet. We will start with a question from the crowd, and then we will go to questions from Sue.
Thanks so much, Melanie.
Okay, the new agreement and parliamentary committees. Committees are obviously used to hold the government to account, Liberal government. Will the NDP be pulling their punches, so to speak, in committees? How will the party caucus be approaching committees sort of in the near future here?
Absolutely. And so expressly in the agreement is that we are going to remain a party that is able to oppose, is able to hold the government to account. That includes in Parliament and in parliamentary committees. We do acknowledge that we want committees to work. And our commitment is to make sure committees aren't bogged down and are working, doing the important work of studies, the important work of making sure people provide testimony and evidence to hold the government to account in a way that is constructive towards our goals of holding the government to account and passing legislation that is vital in this agreement, that's vital to Canadians. So nothing in this agreement precludes us from continuing to be an opposition party that holds the government to account, whether in Parliament or in the committees. We are committing, though, to find ways to make Parliament work in a constructive way, and that constructive way includes opposition, and it includes being able to oppose the government.
Will you be working with Conservatives on committees, on sort of voting against the government committees?
We will continue to use the committees in a way to hold the government to account, and that includes sometimes working with other parties. It will include sometimes working with the government, and sometimes it includes all members of the committee working together. Those things have happened in the past, and I anticipate those things will happen moving forward. Our commitment is we want government to work, we want Parliament to work for people, and that is one of the hallmarks of this agreement, is that we want to see results for people, and that means making sure things get done. And in the past, we've seen that sometimes that hasn't been the case. We're going to make sure things get done, but that doesn't mean in any way we're going to be unable to hold the government to account or to be able to continue to oppose or vote against the government or work with other parties.
Monsieur Singh, j'aimerais vous entendre sur vos programmes dentaires, entre autres les médicaments. Il y a des provinces, notamment le Québec, qui ont déjà ces programmes-là et qui déjà disent, on va négocier des compensations. Est-ce que ça fait partie de vos plans?
Donc, notre programme, ce qu'on offre, on doit toujours travailler avec les provinces et territoires dans un gouvernement fédéral, dans un système fédéral. Donc, on va toujours travailler avec les provinces. Ce qu'on propose et ce qui était dans notre plateforme électorale, c'était le fait qu'on sait que entre 3 gens qui habitent dans notre pays, une personne a aucune couverture. Donc, notre plan, c'est un plan fédéral, comme une assurance emploi, pour donner la couverture aux gens qui n'en ont pas. Donc, ça, c'est ce qu'on propose, d'aider les gens qui n'ont pas à ce moment aucune couverture. Et ça, on devine, c'est presque 10 millions Canadiens qui n'ont pas de couverture. Donc, c'est ces gens qu'on propose d'aider, les gens comme les histoires qu'on a entendues, les aînés qui n'ont pas accès aux soins dentaires, les jeunes, les gens qui ont de leur propre entreprise, les petites entreprises, mais ils n'ont pas de couverture. Donc, on va donner l'aide aux gens qui en ont le plus besoin.
S'engager, est-ce qu'il y a des compensations pour les provinces?
Avec Québec, c'est toujours, on reconnaît toujours le droit de retraite avec plein de compensations, mais ce qu'on veut faire, c'est de mettre en œuvre un programme et on veut montrer comment ce programme va aider les gens qui n'ont pas de couverture à ce moment. Donc, s'il y a des premiers ministres qui ne sont pas d'accord, et c'est à eux d'expliquer à leurs citoyens pourquoi ils sont contre l'idée de donner de couverture aux gens qui n'en ont pas. Donc, c'est vraiment un programme qui va aider les gens, et en particulier aider les gens qui sont dans la situation la plus précaire, la plus vulnérable. Sure. So always with any, we're in a federal system, federal government, we're always going to territories. But what we're proposing is a federal plan, like an employment insurance plan, which will cover those who do not have coverage and who need it the most. That's what we're offering. And so what we envision is putting forward a plan that will cover the 1 in 3 Canadians who do not have coverage and who need it the most. Those are the folks that we envision supporting with this plan. And we've already heard from some premiers that are opposed to this. They're going to have to explain to their citizens, they're going to have to explain to their residents why they're against people getting dental care coverage from a federally funded program. They're going to have to explain why they oppose people being able to get their teeth fixed. They're going to have to explain that to people, and we know that people need it desperately. We've heard this on the campaign trail, but we've heard it in our constituencies. Doctors have heard it in their offices. People have shared stories how they can't get their teeth fixed and it costs too much. We're here to help them out.
We're also in the Canadian Express. There's a massive variation in dental plans across the country, private plans, public plans, the kinds of services that are offered. How could a federal plan capture all the different kinds of people that are looking at all these different kinds of places? What is your vision for exactly how this will work?
Well, with any plan, we're going to look at what works and what doesn't work. We're going to make sure we put in place a plan that follows the best practices and covers the procedures that are most important for people and keep people healthy and safe. We have lots of examples to draw from, and so this is going to be the work that we do, to put in place a plan that's going to cover people in the best way, that's going to make sure people get the care that they need, and we're going to look to see what works and what doesn't work. There's lots of examples out there that will give us evidence for us to make the best decision possible around a plan that covers people. But that's exactly what we want to do. We know that there are a lot of Canadians that do not have coverage, whether it's through their employer or they don't qualify for coverage. We are here to provide them with care, and this is what our program is going to do.
So do you see this working almost like in a volunteer situation where if you don't have coverage, you have to have this federal coverage? And of course, the federal government can take this in a different way. So at what point is it no longer keeping the spirit of the agreement? How far can they take it away from the NDP's original vision?
Well, this is our plan, and we've laid it out exactly the way we campaigned on both in 2019 and 2021. A federal plan to get people care that don't have care right now, that need it the most. And that's what we're going to do, and we're going to work to make sure this happens. It's going to be available to people who need it most, so it's not exactly the same parallel to Obamacare where you had to actually go out and apply for it. This will be a plan that's available for those who need it, and they'll be able to have access to it. It's more like, I'm drawing the analogy, it's a plan that we're building, so it's going to take work to build, but I envision it to be more like an employment insurance plan that is a federal plan that gives coverage to people across the country.
This is a great thing to do. In the last election, we spoke a lot about how the Liberals can't be trusted to get plans like these done and implemented. So what has changed in the last couple of months since that time that you now trust the Prime Minister to get these things done?
We have it in writing. We have an agreement that clearly states what we expect in writing. As far as what we expect year over year, this agreement points specifically to when things should be done, by what date. And the other strength that we have is that we have that document, you have that document, it's publicly available, so we can all point to when the government is not holding up their side of the bargain, and we can point to when we're achieving the results. I'm entering into this agreement with the hope and optimism that we can get people the help they need, but it doesn't mean I'm going into this without maintaining my vigilance, knowing that I'm going to have to keep on pushing and fighting to make sure that this happens. And the only difference now is we actually have an agreement that the government has agreed to, that we can point to, that we can push, and we can fight for to make sure people get the help they need.
And just prior to your work, we were talking about looking at an excess profit tax as a way to pay for that plan. Is that something that the government that Prime Minister Trudeau has already agreed to or committed to you as part of the discussions?
Yeah, it's written into the agreement. So the government campaign, or announced something in the midst of the campaign. You recall I was very adamant that the wealthiest had to start paying their fair share, and I gave lots of examples how the super wealthy don't. On top of that, in a time where cost of living is going up, in a pandemic, we're seeing certain people benefiting from that, and they're making excess profits. And one of that group of people is banks. Big banks and big financial institutions have made record profits, as well as insurance companies. And so the Liberals announced in the middle of the campaign that they would put a surtax on big banks. We've written that into this agreement that they have to go ahead with that tax so that these large and very profitable big banks are paying their fair share. That alone would cover the revenue, or that revenue alone would cover the cost of the dental care program and more. And we're more than excited to look at other opportunities to make those who are making excess profits pay their fair share. We also put forward a motion just a couple of days ago about extending that surtax to big oil and gas and big box stores, because they also have seen record profits and their costs have not gone up at all. And so we're looking at expanding that surtax to other industries where they have made record windfalls, just like we did in the past with profiteering taxes during the war when companies benefited because of a war. We believe that's the right thing to do. Those that are making excess profits should pay a little more.
Are there any more questions on the floor?
Can I just ask, you mentioned that the revenue would cover the cost of the dental plan. What is the estimated cost of that?
So the Parliamentary Budget Office costed a full implementation at about $4 billion in the first year, and then $1 billion to maintain it after that, anticipating in the first year of implementation, lots of folks that didn't have care would immediately take up the program, and there would be an immediate influx or a little bump, and then it would stabilize at about $1 billion. We're looking at the revenue from the proposal of 3% surtax on banks and insurance companies, and early estimates show that that would do more than enough to pay for the dental care program.
Actually, I have a question for Ed Broadbent.
Yeah, Ed, are you up for it, or? Sure. Yeah, okay. Ed, come up to the mic.
Mr. Broadbent, you've been in the House, you've been in this kind of combat with the present-day NDP. Trust the Liberals in this agreement. I asked Mr. Singh about committees. Is it possible for the NDP to sort of go in there and hold the Liberals to account, switch the Liberals in the committee, while also working with the agreement?
This is, in my years of political experience, this is by far the most significant, both in detail and principle, agreement that has ever been reached between a governing party and the NDP. And of course, a key part of this is the requirement of monitoring committees to make sure it's enforced. And having dealt with the Liberal Party for many years myself, when they're in power, it's absolutely essential for the NDP to keep on top of this to make sure that the agreements that have been entered into are actually acted upon.
So can the NDP hold the Liberals to account? Can the NDP hold the Liberals to account to ask that question?
Absolutely, and there's provision in this agreement for the NDP as an independent party to continue with opposition matters as they see fit. That's not restricted.
Are you able to repeat in French?
Yep.
Is your French still good?
Excuse me, I didn't hear.
Français est encore bon?
Pardon?
Do you still speak French?
Oui.
Oui. En fait, je voulais vous demander, qu'est-ce que ça vous dit, cette entente-là, cette alliance? Comment vous la percevez?
Malheureusement, je ne peux pas entendre ce bruit.
Comment vous la voyez, cette entente-là? Comment vous la percevez, cette alliance avec le Parti libéral?
Vous m'avez demandé mon opinion de cet accord en général. Je donne beaucoup d'appui pour cet accord. C'est magnifique, c'est bon pour le peuple canadien. C'est excellent pour les social-démocrates dans toutes les régions du Canada. Je suis fier de Jagmeet et de caucus pour obtenir un accord comme ça.
Est-ce que vous craignez la réaction des provinces quand vous regardez cette alliance-là?
Pas comprendre.
Est-ce que vous craignez la réaction des provinces, comme le Québec par exemple?
J'ai pas entendu la réponse par accord des provinces.
Merci.
Okay.
Thank you, Ed.
That's awesome. You're a rock star. That's so good.
If we're going to go to the same line now, take some questions. I'll talk to now.
That's so good. Mel, you're up. We're ready for any questions from Zoom. No problem. Go ahead, Alex.
Hey, sorry, just unmuting. Thank you very much. On the deal, Mr. Singh, in the negotiations, did you hit any other news platforms such as the wealth tax? Did you actually try and get those things in? Maybe specifically the wealth tax campaign. Did the Liberals reject that? Did you absolutely try to get that in the deal?
Yes, there's lots of things that we pushed for that didn't make into the deal, and that's frankly how we're still different. We believe in very aggressively taxing the super wealthy. We campaigned on it, we pushed for it in the deal, and there's things that we don't agree on. The Liberals don't agree with us on that. We were able to include in the deal to a clause or a component that forces the Liberals to move ahead with the surtax on financial institutions and insurance companies, something that we absolutely support. We think it should go further, but that is a concrete measure to ask one group that's made significant profits in this pandemic and with the cost of living going up to start paying more of their fair share. So that is a strong component. But of course, if we were a New Democrat, if this was a New Democrat proposition as government, it would be very different. But this is what we were able to obtain using our power in the context of a minority government.
Okay, next one. Just on a separate subject, we're expecting to hear more from natural resources experts today about what Canada can do to crank up oil and gas production, maybe sell more through the States to Europe to try and help them get off Russian energy. I wonder what your position is. I'm not sure you've spoken about this before. I think you probably have. But where do you guys stand on this? Do you think Canada should increase oil and gas production to help Europe get off in the short term, to help Europe get off of Russian energy?
Well, our position on that, the question has been raised a number of times. We look at this as just more evidence of how we need to get off of, we need to move towards more renewable energy, clearly. We need to move towards energy that is sustainable, and what's going on in Europe is just more example of what happens or why we need to absolutely double down on more investments in renewables. And so we've taken that position. We think that Canada needs to do more. We need to support with international development other countries that want to do more towards investing in renewables. That's really the future for energy on our planet, in the world, and experts agree that's where we need to go, and that's what we'd like to see happen.
Next question, we have Anya from the National Post.
Mr. Singh, I heard you about defense spending. You said that you're okay with it as long as your priorities are funded, but you also said that the 2% if the main 2% of GDP is too high. So what percentage of spending or what kind of increase would you be okay with?
So I just want to be clear on this. We clearly, and I think you've characterized it, but I just want to repeat it, that we think that 2% figure is arbitrary and we do not support that. What we've supported is the specifics as opposed to a percentage. We've outlined, and I've said before, and I agree that, and I continue to maintain this position, that we need to help our troops have the equipment they need to do the work we ask of them. We send our troops in to do something, they should have the equipment to do that work. And I think that's been a gap that's been identified, and we think that should be satisfied, that should be fulfilled. We've taken the position that the role that Canada can play in the world, where we can invest or increase investments, is in areas where we have been most effective, in peacekeeping, in diplomacy, in international development. That's where we want to see increases in Canada's participation in the world to make this world a safer place. We think those are things that Canada has done and can do to contribute meaningfully. And those are areas that we would invite the government to consider.
So, sorry, are there any other areas of defense spending we need to be okay? For example, where do you stand on war on modernization?
If you could just repeat that again.
Are there any areas of defense spending that you would be okay with? For example, where do you stand on war on modernization?
Again, we've laid out what we would think are appropriate areas for supports. So for our Canadian forces to have the equipment and training they need to do their work that we ask them to do, and in the areas that I've outlined in peacekeeping, diplomacy, international development, humanitarian relief, for example, are areas where we think Canada can play a meaningful and effective role in helping out in what we acknowledge is a more scary world than it's been before. And those are things that we can do concretely and effectively to help out.
That concludes questions on Zoom. Over to you, Lee.
Okay, thanks once again for being here. Thanks to the great folks that have joined us. It's exciting to have a group with us again. Huge thank you to Ed Broadbent, former leader, as you all know. Incredible, clearly has not lost it, has not lost his touch, still has it, and it's awesome to see. And a big thank you to Dr. Kaplan-Mirth for sharing what this would mean, what dental care and pharmacare would mean for her patients and for healthcare, and for continuing to fight to push for more care in primary care, for having a physician, a family doctor, and the other areas of investments that can actually help in improving people's quality of life and health. Thanks so much for being here. Merci beaucoup. Thanks.